Good morning, good afternoon, good evening. It's been so long and it's good to be back again. I am HM Jahun. You are welcome to weekly healthy tips. And today topic is a very important topic, that is neck pain. Neck pain has been a subject of research many years. So we'll discuss about neck pain today and what causes the neck pain and some home remedies that will treat neck pain. First of all, what is neck? Neck is made of vertebra that extend from the skull up to the torso. That is made of bones that extend from the skull up to the torso, that is the thoracic region. And between these vertebra, that is these bones, there is a disc in between each vertebra which absorbs the shocks between these bones. The bones, ligament, muscles of the neck support head and allow the head to move side to side, back and front. And any abnormalities, inflammation, injury can cause pain or stiffness to the neck. And many people experience neck pain or stiffness occasionally in their life. In many cases, it is due to poor posture or overuse. And sometimes neck pain is caused by injury from a fall or a contact sport or whiplash injury. Global Burden of Health 2010 study defined neck pain as a pain in the neck with or without pain repaired into one or both the upper limbs that last for at least 1 day. And neck pain occurs commonly throughout the world. Likewise, Global Burden of Disease 2010 study ranked neck pain as fourth highest in terms of disability as measured by YLDS and 21st in terms of overall burden. And the neck pain and disability associated with pain have a large impact on individuals, their family, communities, healthcare system, and business at large. Therefore, what causes this neck pain? Neck pain can happen for a variety of reasons, but let me mention some. Number one, neck pain can happen due to muscle tension and muscle strain. Neck pain can occur due to muscle tension or strain that may be due to, number one, poor posture. Number two, working at a desk for too long without changing the position. That means those people who have the habit of staying in one place without changing their positions, they have the chances of having neck pain. Sleeping with your neck in a bad position. We have to be careful with the way we sleep because we increase the chances of having neck pain. Jacking the neck during an exercise. That means during performing an exercise, you have to be careful not to jack your neck. Neck pain can happen due to injury also. The neck is particularly vulnerable to injury, especially in falls car accident, sports. It is the case where the muscles and ligament of the neck are forced to move outside of their normal range. So if the neck bones or cervical vertebra, we call it in medical, are fractured, the spinal cord may also be damaged. That means the bones of the neck also protect the spinal cord. Therefore, neck injury due to sudden jerking of the head, we call it as whiplash injury. Number 3, neck pain can also occur due to heart attack. Neck pain, it can be also a symptom of heart attack, as I said, but it often present with other symptoms of heart attack. It does not. That means if someone is having neck pain, he shouldn't consider himself as is having a heart attack. It must have some other accompanying symptoms, such as shortness of breath, sweating, nausea, vomiting, arm or jaw pain. If your neck hurts and you have other symptoms of heart attack, you should immediately seek for medical attention. Number 4, meningitis. Meningitis can also cause neck pain. Therefore, what is the meninges? Meninges is a layer or is a thin tissue that surrounds our brain. Therefore, when this layer got inflamed, it can also cause neck pain. In people who have meningitis, fever and headache often occur with stiffness of neck, and meningitis can be fatal and there's a medical emergency case. So if you have symptoms of meningitis, seek help immediately. Other causes of neck pain can include rheumatoid arthritis. It causes pain, swelling of other joints, and presence of bone spurs. When this rheumatoid arthritis occurs in the neck, it can cause neck pain. And neck pain can occur due to osteoporosis. That is when there's weaknesses of the bones. When the density of the bone reduces, it can lead to small fracture. And this condition often happens to be particularly in hands or knee, but it can also occur in the neck region. And another cause is fibromyalgia. Fibromyalgia is a condition that causes muscle pain throughout the body, and is particularly, especially in the neck or shoulder region. Therefore, when there is fibromyalgia in the neck or shoulder region, it can also cause neck pain. And another cause can be spondylosis. As a person age, the cervical disc degenerates. That is the disc between the vertebrae. They degenerate. Therefore, they narrow the space between the vertebrae and add stress to the joint or to the bones in that area, thereby finging the nerves and then indicating a neck pain. Another cause is cervical disc herniation. When the disc protrudes, it can be from a trauma or injury. It may add pressure to the spinal cord or spinal nerve root. This is called cervical disc herniation. Therefore, it may also be called as slip disc. It can also cause neck pain. And another cause is spinal stenosis. This occurs when the spinal column it narrows, therefore cause pressure also on the spinal nerve roots as it exits the vertebra. This can be due to long-term inflammation or caused by arthritis or other conditions. And in rare cases, neck pain or stiffness can occur due to congenital abnormalities, that is, due to before the birth or during birth, infection. It can be due to abscess, it can be due to tumor, or it can be due to cancer of the spine. Therefore, if the symptoms persist for more than a week, you should immediately seek for medical attention. And if neck pain is accompanied by one of the following symptoms that I will mention, therefore it's a medical emergency also. If neck pain is severe without an apparent cause, if there's neck pain with lump present in your neck, or if you have fever, headache, nausea, vomiting, weaknesses, tingling, and trouble swallowing or difficulty in breathing, and also pain that radiates toward your arms or toward your legs, or inability to move your arms and hands, or inability to touch your chin to the chest. If you have any of the following symptoms that I mentioned, you should immediately seek for medical attention. What are the remedies that can be done at home to ease neck pain? You can apply ice on the neck, not directly to the neck. You should get your ice block, wrap it with the towel, put it on the bed, lie on the bed. That means the ice should be under your neck for a few days. After that, you can apply hot pack. That means you can boil water, put towel inside, then put it under your neck, or you can take hot shower. You can take OTC pain relievers such as ibuprofen and acetaminophen, etc. If you are into sports, you should take a few days off from the sport, and any activities that aggravate your symptoms, such as heavy lifting, you should avoid it. Resume to your normal activity slowly, and then you should exercise your neck every day. Slowly stretch your head like this, side to side, front to back. Rotate your neck like this, and avoid cradling your phone between your neck and your shoulder like this. This is our normal behavior, so you should avoid doing this habit. And you should change your position regularly as you sit, like tailors, all those people who have the habit of staying in one place. They should at least each 1 hour change their position. Use a special pillow. You should not use hard pillow while sleeping, and don't use any neck brace or collar without doctor's approval, because if you don't do them appropriately, the symptoms might become worse. And then, if all this didn't work, you should seek for medical treatment. Your doctor will perform physical examination, take your medical history completely. You should tell your doctor over-the-counter medication that you have been taking. You should tell him about your recent injury and about the specific symptoms that you are experiencing. And the treatment depends on the diagnosis. Therefore, the doctor may need maybe one of the following: blood test, CT scan, X-rays, MRI, and electromyography. This electromyography will allow your doctor to check the health of your muscles and the nerves that control the muscles of your neck. And depending on the result that he gets, he may refer you to specialists, and the treatment can include ice and heat therapy, exercise and stretching, pain medication, corticosteroid injection, muscle relaxant, and cervical collar, that is cervical collar or traction. And if there is infection, he may prescribe antibiotics for you. And hospital treatment, if condition such as meningitis or heart attack is a cause. And finally, if all this didn't work, this conservative treatment, he may refer you to surgeon for the surgery, which is rarely necessary. And there's some other alternative way of treating neck pain nowadays, that is by acupuncture or chiropractic treatment or osteopathy. And depending upon the result, as I said earlier, I hope this break video will help a lot. So if it does, give us a thumbs up, like our videos, and share our videos. And if you didn't subscribe to our channel, subscribe. HM Jahun, that is YouTube channel, because this will help a lot. Thank you. See you next time.